I rise today to discuss the so-called Freedom for Healthcare Workers Act. This legislation is an attack on public health and will endanger the lives of medical personnel and patients. Why should we remove vaccine protections for nurses and medical workers in our hospital and clinical settings? This bill is not supported by our public health officials and certainly not supported by our nurses on the ground. Why would we endanger vulnerable populations? This is cruel and irrational. Over 1 million people have died in this country due to the pandemic, many of them nurses and healthcare workers. One of them was my mother, Gabrielle O'Donnell. My mom was my rock. She was a kind, loving, and strong immigrant woman who dedicated her life to serving her country and community. She served our country as a frontline healthcare worker. My mom also taught me that what real patriotism is serving your neighbors through service and giving back to your country. She was on the front lines of this pandemic, helping as many people as possible. And in the summer of 2020, my mom lost her life to COVID-19. Now, this vaccine could have saved my mom's life, but it was not yet available. Now, I made a promise to my mom and to my community to fight for legislation that would protect them and keep them from the pandemic and keep them healthy. No other family should have to go through what mine did and millions of others have had to go through in this country. We know, due to science, that the vaccine saves lives. And our medical workers should be able to go to work knowing that their lives won't be in danger due to the service they are giving to our country. Vaccinating hospital and healthcare workers is a basic form of protection that they all deserve. For this reason, I urge my colleagues to vote no on the Freedom for Healthcare Workers Act. I yield back.